Hey everyone, welcome back to my pharmacology series again, and today we're going to talk about insulin. I know we all feel like insulin, it's too hard to remember if you're staring at a textbook, trying to memorize 20 different names of insulin, onset time, peak time. Don't worry about it. We're going to break down 4 types of insulin today, and it would be easy for you to remember, and you will never going to miss any insulin question. So there are mainly 4 types of insulin: regular, NPH, Lispro, and Glargine. So let's talk about regular insulin first. So regular insulin is so easy to remember. R stands for regular, R stands for run because it can run through IV. It's a clear solution, so you can easily run it through IV line. R stands for rapid. It works so fast. So remember 3 numbers, 1, 2, 4. 1 is onset 1 hour. 2 is peak time, which is 2 hours, and it lasts for 4 hours. So that's how you remember 1, 2, 4. R stands for regular, R stands for run, R stands for rapid. Second type of insulin is NPH. NPH is also very easy to remember. Listen it carefully. N stands for NPH, N stands for not in IV, N stands for not so fast. So NPH is intermediate insulin. It doesn't work so fast like regular insulin. It's cloudy, so you cannot run it through IV because it starts precipitating after some time, and you never know how much amount of insulin your patient is getting and on what rate. It's going to be hard for you to judge, so that can be dangerous for your patient, so you can only give it through sub-Q. The other thing you need to remember is the onset and peak time. So how regular insulin was 1, 2, 4, just remember the further 4 even numbers. 1, 2, 4 is for regular insulin, and now 6, 8, 10, 12. So 6 hours it's onset time, 8 to 10 hours peak time, and it lasts for 12 hours. So 1, 2, 4 for regular, and then 6, 8, 10, 12 is for NPH. And that's how you would remember NPH and regular. And see, it's so easy to remember. So other two, Lispro and Glargine, those are your extremes. It's on opposite sides. So Lispro is very fast acting. On the other hand, Glargine is long acting. So Lispro is, you need to remember 15, 30, and 3. So 15 is onset time, 30 is peak time, lasts for 3 hours. It's really important to know when it comes to Lispro, you cannot give it 15 minutes before meals. You have to give it when your patient is actually eating their meal. For example, if you give 15 minutes before the meal, as you know, in hospitals, there's no fixed time of meals. Sometimes we get trays earlier, or sometimes it can be late as well. So if you're giving 15 minutes early, then maybe your patient is getting their meal tray after 30 to 45 minutes. So your patient would be already unresponsive to eat their meal. So you have to give it when patient is actually eating. So you need to remember, if you're not disturbing your patient while they're eating, to give their